I'm Dr. Katherine Pelch, an assistant professor at the University of North Texas Health Science Center. I hold a PhD in biology and have expertise in evaluating the health effects of PFAS and similar harmful chemicals. I have also been working in collaboration with scientists to systematically evaluate the decisions and judgments made by the 18 US federal and state agencies that have conducted risk assessments for PFAS in drinking water. I'm speaking today in favor of Bill LD 164 to set a combined maximum contaminant level for 6 PFAS at 20 parts per trillion, and strongly urge you to include a provision that would require monitoring of water supplies beyond these 6 PFAS. Over time, proposed and adopted MCLs, notification levels, and health-based guidance values for PFAS have continued to become stricter and more health protective as new scientific studies indicating health harms at lower exposure levels have become available. Leading scientists currently suggest that drinking water levels of several PFAS should be in the range of 1 to 2 parts per trillion in order to account for a variety of health effects that have been observed at low levels of exposure, including disruption of immune system function. In line with this, many states have set values in the low part per trillion range for several PFAS. The states and agencies that have set the strictest values have included considerations that more adequately protect infants and children, who represent a vulnerable and susceptible population for PFAS exposure. The young are vulnerable because they consume more water on a per body weight basis than adults. The young are also particularly susceptible to the harmful effects of PFAS due to their rapid growth and development, and the potential for the establishment of long-lasting health effects, including decreased response to vaccines and changes in hormonal signaling. It is important to note that the existing lifetime health advisory from EPA of 70 parts per trillion for PFOA and PFAS is outdated and does not consider the effects of PFAS observed at low levels of exposure or account for the vulnerability and sensitivity of infants and children. Many PFAS share similar toxicity concerns, indicating that combined or cumulative toxicity is of concern. To begin to address this, some states have set combined standards, for example, Vermont and Massachusetts, with their standard of 20 parts per trillion for 5 or 6 PFAS respectively. However, I would argue that the proposal to regulate 6 PFAS at 20 parts per trillion does not go far enough, considering there are many more PFAS in use and detected in the environment with both known and unknown effects on health. I refer you to the technical guidance that my colleagues and I recently submitted to the Agency of Natural Resources in Vermont, which outlines in detail how the state can take steps to more comprehensively regulate the class of PFAS in drinking water. And I'm happy to take any questions. Thank you.